Good morning. That's a lot of people here.
That's great.
So our presentation is going to be slightly different in that what we're going to do is have a little bit more of a conversation with us, as well as presenting what we're actually doing, okay? The first thing that we're going to say is, let there be light. And as you can see, there's light everywhere. We have light pointing at us right here. There's light actually coming here onto the screen. And naturally, there's a lot of light everywhere in your environment. So what is light itself? Light is basically energy, and it comes in the form of photons, and it's all at different spectrums. So light is different spectrums, different wavelengths, and it comes in different types. Some are visible, some are not, but it's everywhere. Naturally, you have the sun. The sun has a lot of heat energy, and everybody loves going outside and having that sunlight hit their skin, which then actually creates a bit of a cellular reaction as well, which we'll talk about in a little bit. Then you have the moon. This is reflected light, so you can see at nighttime. And it can be quite beautiful to be out in the dark and have this moonlight. Again, it's light, a different type of light, but still light. Then you have electrical energy or lightning. Still light, but a different type of light. What else? You have fires. Fires give off a lot of heat, but they can still be beautiful and still actually create a lot of light for you. And as the lamp was at the very start, as you could see, it's still a light. Again, different spectrum, different type of light, but still light. And then you have the stars, which are gas, but still give out a lot of light. Different spectrum, different type, again, light. Anita is going to tell us just about those different wavelengths that we're going to be interested in, particularly for the type of light that we administer and what we're actually doing.
So when we look at light and the light that we use for treating Parkinson's or neurological conditions, we're looking at visible red light, usually within that spectrum of 600 to 700 nanometers, somewhere on the electromagnetic spectrum. And then we're also looking at infrared light. Visible light will not penetrate as deeply, but we have indirect effects as well. So it's not just penetration, but what that light can actually do at a cellular level. And then when we talk about infrared light, which can penetrate much more deeply, that wavelength of light can penetrate up to about 5 centimeters. But again, we have that direct penetration as well as the effect of light on cells and what we call a downstream effect. So 2 wavelengths of light.
Sorry.
Nope, that's okay. So
works differently on your computer.
Yeah, right. Perfect. So essentially, those are the wavelengths that we use for light therapy. And when we talk about how do we harness that power of light, we're really going to be looking at how are we, although we can certainly treat a number of neurologic conditions, today our focus is Parkinson's, how do we harness that light and use it to affect Parkinson's motor and non-motor symptoms? And then we'll talk about how we're treating Parkinson's in our randomized controlled trial.
So good morning. As we said, we are going to be how we are treating the motor and non-motor symptoms of Parkinson's using photobiomodulation or light. As we were introduced, my name is Orla Hares. I have a Parkinson's Wellness Center in Hamilton. And one of the backgrounds for me is that I do use a lot of that neuroplasticity, relearning, brain retraining, activity and exercise and movement in my center. But one of the other things that I couldn't do with a lot of these non-motor symptoms and other issues that people actually suffer from is I was trying to find something else that we could actually work with. And one of that was actually light. Anita?
Yeah, I'm Anita Saltmarche. I've been involved in this area for over 20 years now. We started with traumatic brain injury and have moved through the treatment of Alzheimer's and dementia, conducted a trial in Toronto looking at that, had very good results. And so we've gone on looking at other neurologic conditions. And we definitely treat adults, but I also treat children with Down syndrome. Can't change genetics, but we can certainly help with speech acquisition and other conditions. So, but our focus again is photobiomodulation. So, big word for light therapy. And the reason I think it's important that you're at least familiar with it is that light therapy or photobiomodulation, if you're going to look at the literature, this is the term you're going to see, photobiomodulation. Although it's had many different names, it's been soft laser, low-level laser therapy. One of the newer terms now is, well, light therapy, but red light therapy. I think a bit of a misnomer because we're using red as well as infrared energy, and phototherapy. So there have been many different terms that we've used over a 50-year process of using light therapy medically. So let's look at that history. So you're all familiar, really, with light therapy. If it isn't seasonal affective disorders that we look at, it goes back a long way. The Greeks actually not only worshiped the sun, but they were very well aware that light, the sun light, had very positive effects. And then here we're looking at TB Center, where kids are out in the sun and achieving positive effects with that. And then if we start looking at this weird contraption up there, we're kind of capturing that light and trying to direct it down to a patient in specific areas. We've been using light therapy preoperatively to precondition before surgery, and it would be interesting to look at DBS and how we could possibly even precondition with that. There are lots of surgical procedures we treat before and then after. And then seasonal affective disorders. So that bright light therapy can be very effective for anxiety and depression because we have so little sun over the winter. And then little babies, little infants, way long ago, we used to put them in the sun. Now we put them in little blue, violet bassinets, and we give them light therapy to decrease the bilirubin. And here we're just talking about the muscle joint conditions that we treat with light therapy, and that's been done for years now and can be quite effective, which is a great adjunct to treating Parkinson's, because when you do have muscle and pain issues, we can also use it for that. Oh, anesthetics. Yes, that's a big one these days. The use of light, either on skin, whether it's eczema or something like that, but certainly increasing collagen production, and that's why we're using it aesthetically, as well as, believe it or not, decreasing fat cell size and decreasing body size.
So some of the newer type of units that are being used, particularly the ones that we've been used, are these ones. So we said that we would bring in live units so that you could actually see it for yourselves, that these are real things. This is our helmet unit that we actually use, and then there's a handheld unit. And we'll go through some of the parameters of these in just a few moments. But this is just the handheld one, nice and easy to actually use. And then our helmet one that we've actually used as well. So it is bright red, so if you are sensitive to light, just be careful in here in that it's bright red and you're going to look like you are all lit up, okay? We'll go through this in just a little bit, just as we're talking about our trial as well. Okay, just to show that they're real devices, okay? So yeah, we do need to actually tell you a little bit about the actual photobiomodule itself, okay? So Anita?
Yeah, so it's a big word, but when you break it down, it makes a lot of sense. We're using photons, light, and biological effects on the body are created by using that light therapy. And we used to say it was photostimulation, but in fact, we can modulate cellular activity to increase or decrease, depending on what it is we're treating. So it's just a big word, photobiomodulation. We're gonna say PBM for short during the presentation, but that's what we're referring to. Now, photobiomodulation is not that dissimilar to photosynthesis in plants, and it's taking on that light energy and using it at a cellular level. So because we're talking about light therapy at a cellular level, we can treat many different things. This has always been a little bit of a bugaboo within the medical community, as well as everyone. How is it you can use light therapy and treat so many different things, from Alzheimer's to dementia, Parkinson's, down to, believe it or not, they're now starting to treat toe fungus. So, I mean, and everything in between. So, in fact, light therapy, depending on how it's delivered and the amount of energy and wavelength, we can treat all of these different conditions. And it's now becoming part of clinical practice. If we look at oral mucositis, there's research going on right now, and it has been for quite a while. So these are individuals who are being treated for head and neck cancers, and we use light therapy beforehand to precondition them, and then during radiation, and they have 7 weeks of radiation daily, and this prevents oral mucositis. So there are many different things we can do with light therapy. Does it work? Whether it's DBS, light therapy, exercise, or anything you're going to look at, first and foremost, is it safe and does it work? We know light and laser therapy has been around for over 50 years. Well over 8,000 publications, 800 of them that are randomized controlled trials, clinical trials, and you know, in well received and peer-reviewed journals, whether it's the Lancet, and journals all over the world. So it's important that you really question whatever you're looking at, what kind of research support is behind it.
So the type of research that we're actually doing is a randomized controlled trial. There was a placebo arm. It's currently a very active trial. We have about 8 participants to finish. So unfortunately, we cannot tell you our results right now. They will be published in the new year, so you're going to have to watch this space. But the trial has been incredibly interesting. We've met some very, very nice people from Toronto to Hamilton, from not quite this area, but from very close to where we are. 60 people completed it. Treatment actually took 12 weeks. For the phase 1, we had a phase 2 as well. So we're currently finishing phase 2. Phase 1, 50% had a placebo, 50% had actual active treatment. And then at the end of the 12 weeks of that phase 1, everybody ended up with actual active treatment. So some people had a double dose, some people had just 1 dose. And we're going to be super excited about actually trying to present the results, because I think it's going to be quite fascinating. We treated both the head and the gut. So as I've shown you before, these are the units that we use for the gut. This one is in standby right now. You push it onto your skin, and we treat your tummy just by pushing this little device down, and it's preset for 1 minute. So you have 18 minutes on your gut, and then this wonderful psychedelic helmet that you wear is for a 24-minute unit. So you sit there for 24 minutes, and it runs through your programs, 12 minutes of that bright red, and then 12 minutes of the near invisible red. So these devices, you know, as we said, are very user-friendly, and everybody that we had care partners as well involved to actually try and administer this, and you're administering it 3 times a week for half an hour. And we may be saying, what is the actual difference between these two? And Anita, if you can explain just why they are so different and what we're actually doing of this one on your tummy and the other one on your helmet, and this one isn't actually being put on your actual head itself.
So if we're looking at, 2 different wavelengths that we use most frequently, visible red and infrared. And as you saw, the helmet's visible red, but it also has infrared in the helmet. And then the PD Care laser is a laser. It's a 904 super pulse laser. It has greater depth of penetration, and we treat the abdomen with that. So we're using a combination of laser, which are totally safe for home use because the beam has been diffused slightly, so there's no potential eye damage or anything else. And we know these individuals because they take them home. They did their own treatment at home over this time frame. And I've been doing this for almost 15 years now. My practice is virtual. So I work with individuals, teach individuals, they purchase their own devices, And they can do it. And that's why these things have been simply designed for self-treatment. So combination of laser as well as LEDs. So what actually happens? The light penetrates through into the tissue, whether we're using a laser or the LEDs. And there used to be a thought that only a laser would work. We now know that's not true. LEDs will work as well. But as you press that laser or put that laser against the skin, it penetrates, and it's actually absorbed at a cellular level. So within the cell, there's the mitochondria, which is like the engine of the cell. And what light therapy does is absorbed by the cell, and that energy essentially increases ATP production, and that just means the cell is developing its own energy. It's producing its own energy. And so it's also getting rid of nitric oxide. Why is that important? Cells that aren't functioning optimally often have that nitric oxide within the cell structure. And when it's dissociated or comes out of the cell, it causes vasodilation. Why is that important? More oxygen and nutrients in the area, as well as increase in vessel size for lymphatics. So we're seeing changes at a cellular level. So on the brain, we're actually, so what does this bring about? There's an increase in tissue repair and healing. There's also decrease in inflammation. If light does something incredibly well, it's the decrease in inflammation that can take effect. So that's one or the other. And that, whether it's muscle or brain, we can bring that about. That increase in the circulation, so blood flow to the area, oxygen and nutrients, increasing or modulating the immune system. And that's happening particularly when we're treating the gut in Parkinson's. And so what we're doing is supporting the immune system in this process. And then just increasing functional connectivity in the brain. We have hubs in the brain that need to communicate with one another. And what we've seen on functional MRI as well as other testing, that these hubs will actually communicate more effectively in the brain with the use of light therapy. And then the neuroprotection. It's been shown that we can actually protect with light therapy the cells that are still functioning and help them to function more optimally. And then the lymphatic drainage. So our lymphatic drainage, which is taking away all our byproducts and toxins in the body, we now know there's the same system in the brain, the lymphatic system. And we can actually increase the lymphatic drainage from the brain, which is important when we're trying to get rid of neuroinflammatory processes. So we're treating the brain with this helmet, and there has been a lot of discussion about whether or not these are LEDs, they're not lasers. And yet, again, we've been able to demonstrate with functional MRI that those photons are actually making it into the brain, and we see an increase in cellular function as well as an increase in cellular perfusion over the areas we've treated. And this helmet's been specifically designed to not only treat the brain, but increase lymphatic system, or the lymphatic drainage at the back of the brain, so that the diodes have been placed specifically for Parkinson's. And so these are the effects we get. Now, we're gonna start treating the gut. Everybody thinks, well, we're treating the brain, that makes sense. Parkinson's may have started in the gut, or at least had gut issues for up to 10 years before you actually see the symptoms. So we treat the gut to hopefully regulate the microbiome environment. So all those little critters that live in the inside of your lining of the intestines, very important. And they have a huge impact on our cognitive well-being as well as on our behavior, and certainly increasing serotonin and dopamine production.
So some of the results that we've actually seen with treating the gut are things like your decrease in constipation. And I'm going to refer back to a couple of the clients that I have that are not being treated as part of the trial, but who've treated outside of the trial. I've had one lady who's a registered nurse that had constipation for over 25 years, was taking Restoralax, was taking suppositories to actually try and help her to go to the bathroom. She's been doing the gut treatment alone, not the helmet, gut treatment alone, and she had a 25-year history of constipation. She's now going daily, which is amazing. And she didn't change anything else. Now, we do a lot of exercise, but there's some things that she just cannot affect, even with her exercise. Sleeping well, so sleeping has actually improved, and the quality of sleep that a lot of people are reporting is a lot better. So they may still sleep only 4 hours in a go because they still have to go to the washroom in the middle of the night, but that 4 hours is a better quality, and they're not moving around as much, and their care partner in the bed beside them may say that they're not actually calling out, or they're not actually getting hit, okay? And that's without changes in medication as well. An increased smell. So this one always makes me laugh because the increased smell, I thought, okay, once your smell was gone, it was gone. But I had one gentleman say that all he wanted was to smell his coffee in the morning. What he got instead was actually he got to smell his dog poo as he picked it up. So when you get your smell back, it's not the good, you have to get the bad as well. So you do get both, but he does actually get his smell of the coffee as well in the morning, which is amazing. It helps to increase your memory and your cognition. So it doesn't improve it all of the way, and it's not a cure, but this does help to improve your alertness, the acuity of how fast you can respond and how well you remember conversations and how you interact with your peers, particularly in a group. And it helps to get people out of their shell and helps with that social isolation. So the decreased anxiety and the depression that you may get all help to feed into each other if you actually can improve your conversation skills and your ability and your animation with those conversations as well. The gait, balance, and mobility have improved. Now, again, with our trial, you do have to remember that I have a Parkinson's Wellness Center. I have Rocksteady Boxing. I see them over here. We have some sort of dancing. We have yoga, Pilates, boxing, and power moves, and smoothie rings. We have a lot of movement-based exercise classes. Neuroplasticity is the base of what we do. But with this light therapy it's a really nice addition because people have had a little bit more oomph, a little bit more energy to be able to get greater outcomes for some of the activities that they're doing. But again, it's not a cure. This actually is really just a good help. And this was just treating the gut. So some people were just treating the gut. One of the case studies that I did was a 79-year-old gentleman who is a wonderful individual. He does as much exercise as you possibly could do in one day. He puts everybody to shame. He's a referee, so he may actually have to go and referee and do 3 matches in one evening. So he's running up and down the court. So he's very, very active. He goes to the gym in the morning. He does pool exercises. He hikes, he bikes, he walks, he golfs, he does it all. He had a very tremor-dominant type of Parkinson's. So first thing in the morning that he was really struggling with was doing the crossword. He couldn't do his morning crossword, and he couldn't drink his coffee because he was making a big mess. He started just the gut treatment alone, so the handheld device, the PD Care unit, and he came into me in August 2022. One of the ways that we do as an outcome measure is actually look at their writing. This is what he wrote in August 2022, four lines, and I don't know if you can even read this right now. I'm not going to tell you just yet. It took him 2 minutes and 50 seconds, probably 21 as well, to write this, 4 sentences. In December 2022, it took him 1 minute, 26 seconds to actually write this, and as you can read, it says, Mary had a little lamb 4 times. He came back again just last week, and he did so this is a comparison of both. So you can see the difference between both. And he didn't have anything different. He didn't change his medication. He didn't change his exercise. He does everything anyway, so he didn't change anything. And this is a side-by-side. When he came back in, you can see that his writing has been maintained. And it's actually even a little bit better, but this took 56 seconds to actually write. He has upped his dose of medication by half a pill in the middle of the day. and he's still exercising. He currently has said that his fatigue is getting a little bit more than what he is normally used to, so he's starting the helmet to see if that's going to help him get a little bit more of that energy that he's looking for in the evenings. Although I'm exhausted listening to him half the time, but he's still well able to do everything that he does, and he's fatigued from it. And this is what we're going to try and help him with. And that's nothing that I have done as a physio for him. He actually has been doing this on his own because he's so active. I actually don't need to have a huge amount of that neuroplasticity or brain retraining with him because he does it all already.
Which is great.
So this is, again, side by side between October and now, or December and October of this year. Slight difference. And then...
So I'm just going to talk to you about a patient I have in Germany right now, and she was diagnosed with Parkinson's back in 2011. And at that time, she did change her diet pretty significantly, and she's now a vegan. And she felt that made a very big difference for her. Not for everyone, but for her, it did make a big difference. And then regular exercise. So she walks, she does an exercise class, she swims. So those two things were already there and in place. As time went on, though, she did have a bit of a decline. And through a colleague that I work with in Boston, we met up virtually. And so she started the light therapy. She started with the gut protocol, and she's just recently started the helmet. And so she wrote me an email one day, which I was really surprised. Now, I have to preface the fact that everyone responds to light therapy differently. She happened to have quite a remarkable change. It's not often like that. Neurologic change normally takes quite a while. It can take weeks. But in her instance, after 4 treatments, she was talking about literally yesterday and today having no Parkinson's symptoms. And she'd had Parkinson's for 12 years. She was overwhelmed, to say the least, and very grateful. Now, that was wonderful. She decided arbitrarily, without consulting her neurologist, to significantly decrease, because that seems to be a goal of many people with Parkinson's. I want to get off these meds. I want to decrease my meds, which she did, and she did decline. This is a wonderful adjunct. It is not a replacement for other things going on. And so it was only after I spoke to her and she had declined, and I'm sort of going, what's going on? Well, and overnight, halved all my Parkinson's meds, and that's where she ran into problems. She's restarted her Parkinson's meds. She's not quite where she was after the initial treatment, but she's definitely starting the helmet now, and stay tuned, we'll see how she does. But so we can see very good results. And there are others that don't have results. We probably see results in, across the board, neurologic conditions about 76% of the time. And that's not like full, no longer have symptoms, but improvement. So yes, it can make a really big difference. So in summary, I've been doing light therapy for over 21 years now, and in my experience, whether it be infants or adults, it seems to be quite safe. I've had, and the literature would indicate, no significant negative consequences, and quite positive. But it is not a replacement for what you're doing now. Your exercise is important, your medications have to be prescribed by your physician. This is an adjunct, one more thing you can add to the toolbox potentially. Enhancing physical therapy and exercise program results. We know in the muscle joint rehab setting that by adding, and these are randomized controlled trials, if we look at chiro and PT and we add light on, so we compare either that therapy on its own, laser on its own, or combined. By far, almost 20% increase in outcomes when we combine those. So it helps to enhance those outcomes. And certainly improve functional outcomes, fine motor. So we hear everything from, I can do my own necklace up now. I don't have to have somebody else do it for me. Or I can button my shirt up without assistance. So
or the crossword in the morning.
Yeah, right, or crossword in the morning, or being able to hold a cup of coffee and not spill it all over for more gross motor movements and gait and balance. And potential positive effects on mood, motivation, and activity. We use light therapy for treating depression and anxiety as well now, separate from Parkinson's. So we can definitely see that. And quality of life related to quality and quantity of sleep. There have been a number of studies, traumatic brain injury and others, where they've measured amount of time of sleep and quality, and it's been increased. It's actually one of the first things we see a change in often is sleep. And then optimize memory, function, and focus and attention. We've seen that in Alzheimer's and dementia. We'll wait to see in our trial how it works out that way, but it has the potential of doing that as well. So
yeah, so you know, our trial, we can't recruit anymore. We are fully, we've recruited, we're finished with our trial. We're waiting for the last 8 people to finish. Our results of this trial are going to be done at the end of the year to the start of the next one. So hopefully we'll get that published, and then we'll be able to present what we have actually found. But with the case studies that we've been using some of this treatment and this protocol with, a lot of people are getting a lot more benefit. There are certainly some people that you just don't respond to, just like the DBS, you know, it may not be for you, and you may not even work, that's okay. But you know, we are trying to get everybody moving and living well with your Parkinson's, and that's the main idea of our wellness center in Hamilton, is actually to do that, and this is just the other adjunct, another thing that we can add into the treatments 3 times a week. Okay.
That's great. Thank you very much.